Hello again, ladies and gentlemen, and welcome to another fascinating episode of the AJ Roberts Show on the London Times. Today we are joined by none other than the superstar himself, Dr. Peter McCullough, all the way from Dallas, Texas. As I explained in my social media leading up to this episode, guys, Dr. McCullough is an academic physician, and has been specializing in many areas around what we're seeing over the current 18 months. Everything from like the vaccines to injuries to basically everything health and scientific related. He's been on some of the top shows all around the world, and I'm delighted for him to be able to join us today here on the AJ Roberts Show. Dr. Peter McCullough, welcome.
Well, thanks for having me on the show. As introduced, I'm an academic internist cardiologist. I'm a trained epidemiologist. I focus on the medical aspects of disease. In the last 18 months, I have developed really a clinical competency and academic scholarship and excellence in the area of SARS-CoV-2, COVID-19. I felt every doctor in medicine, broadly, primary care and medical specialties, really needed extra knowledge and competency in COVID-19 because so many patients became sick with it. It absolutely overwhelmed the infectious disease community that's been largely subscribed to inpatient care. And yet so many patients have been influenced. And I'm glad to talk about this issue of vaccines, the clinical strategies, and particularly vaccine injuries.
Yeah, absolutely. And it's becoming such a prevalent topic at the minute here in the UK, but also obviously we're seeing it a lot in Australia, and we've been seeing it for many months in the United States and Israel. Which is a very large amount of these injuries that we're seeing. What at the moment, from your expertise and the conversations that you have with physicians all around the world, because I understand you do a lot of meetings. What's like the most common injuries that you're seeing, sort of like in these countries at the moment?
We would need to go to an analysis by Rose that was published in the American Journal of Public Health and Policy and Law, where from the U.S. Vaccine Adverse Event Reporting System, VAERS, the non-fatal vaccine injuries were summarized, and they fall into basically four broad categories. One is the cardiovascular system of the heart and the blood vessels, including blood clotting. The second is the neurologic system, both the central nervous system and the peripheral nervous system. And then the third is immunologic. So there are various autoimmune syndromes that arise as the body is producing antibodies directed against the spike protein as it's expressed in human cells. And then lastly, the hematologic system, the blood system. So we have four broad categories of vaccine injuries. And there is a published literature. And I want your audience to understand that everything I'll talk about today is cited in the published medical literature. So it's there permanently. And so all of these vaccine injury syndromes can be reviewed. In the United States, we've had over 750,000 permanent VAERS safety reports filed. So that is a astronomically large level. In the United States per year, all vaccines combined for all the prior years, it's about 16,000 safety reports per year. Wow. So to go from 16,000 to over 700,000, and with the numbers of individuals, we've had over 15,000 Americans and those receiving the U.S. products elsewhere die after the vaccine. An analysis by McLachlan and another one by Rose has demonstrated that of those individuals who die, 50% die within 48 hours, 80% die within a week, 86% of the time, there is no other explanation for the death. So we know the deaths are the most striking feature of the vaccines. We're going to leave those aside today. I know people are terrified of dying immediately after the vaccine, but worse than that, there have been over 250,000 hospitalizations, emergency room visits, office visits for forms of vaccine injuries. And sadly now, the CDC tells us over 20,000 individuals are permanently disabled as a result of volunteering for the vaccine program.
Horrendous, like 20,000, and you touched on the number there. That's more than any injuries of any vaccines put together.
That's true. And what I'm talking about is this has created a whole new disease category. So just like COVID-19 is a brand new disease category, and the outcomes of COVID-19, particularly the long hauler syndrome or long COVID, is now a new challenge for doctors in medicine. The vaccine injuries is now a new broad category of illnesses that's going to be a brand new challenge for American, UK, and doctors all over the world.
Yeah, it strikes me how, there's obviously so many podcasts that are going out there and so many broadcasts and interviews that you do, as well as other physicians around the world. I know a lot of it gets censored and that, but like, I know so many people that have seen like my shows with like these incredible physicians, and they still go and take the vaccine and they have horrible side effects from it. Do you think a lot of it is down to sort of like social pressures and pressures, or needless pressures from employers and these mandates that they're trying to creep in?
Remember, the vaccine program started out in December, certainly in the United States, I think a little earlier in the UK, but it started out as being purely voluntary, and no one had a problem with the vaccine program when it was voluntary. And then as the safety data came in, word of mouth spread. We didn't need any media or any doctors going on podcasts for people all over the world to learn that their loved ones were being injured and some were dying after the vaccine. So rates of vaccination absolutely plummeted in April. And most vaccine centers by the end of April into May, June, and July were absolutely empty. They were mothballed. No one was going for vaccines because they knew the vaccines weren't safe, not safe enough in everyone. And people were terrified of these injuries and deaths. In fact, there was an informal internet survey that was done a few months ago that asked the question, do you know somebody who's died of the COVID-19 in your circle or in your related circles? And the answer was 12%. Actually I've heard of someone who died after the vaccine. And so, and I've seen this in my clinical practice. So for that reason, vaccination completely fell off. In the United States, that was at about 40% or 50% of the country vaccinated. And then the social pressures and coercion kicked in. So all the subsequent vaccination that's occurred has been in unwilling individuals. So they're taking the vaccine not because they think it's a good idea or because it's healthy for them. They've been taking the vaccine because of social pressures. And what each person needs to ask themselves is, what's the social contract that they in fact sign when they get a vaccine? For instance, are they getting 3 months of employment or 6 months or 12 months? Do they get a passport to travel? And is that going to be durable? And for how long? And then what happens next? Most people can't answer the question of what's the social contract. What are they actually getting out of taking a vaccine outside of a very limited short-term pressure? Most people think they have to do it to keep their job, but they don't know what the next step is going to be after that.
Yeah, and I think that's been the problem all the way along. Like everyone's been looking very much short-term and not looking long-term. And I've mentioned a lot recently that I'm getting a lot of messages from people that are saying that they went and had the vaccine because they thought they needed to travel, and in some cases here in a classic British style, thought they needed it to go to the pub. But they're obviously regretting it at this point because they now see it for what it is. They're seeing people in their own families that are having bad adverse reactions to it. And there's lots of questions around, like, what do they do now? And it's becoming more and more prevalent that is now the case, because here in the UK, it's kind of like lulled down a little bit. They have rolled it out to kids, but in general, the people that had them a long time ago are in a no better position than what they were without, if they hadn't have had it. So obviously that a lot of adults are asking that question, what did I even go and get this for? And now that a lot of this information is now coming out that in fact they're not safe and effective as what the pharmaceutical companies made out, and they're really, really regretting their choices.
Well, let's pick up on that. So the social contract, as I mentioned, in most of the cases is unstated. I've asked people, do you getting 3 months or 6 months or 12 months of employment? Are you getting 5 years or 10 years? I mean, is there anything that you can weigh out? We know people in our circles, for instance, students who have taken the risk of vaccination where it can't benefit them whatsoever. I mean, some people have already had COVID, so we know the vaccine has absolutely no effect there and only harm. And in order to try to attend school, but then school's been canceled and they have to go on WebEx anyway. So they've actually taken a biologic risk, a health risk for no side of the social contract. So I think everybody needs to ask about the social contract. And then you mentioned basically the medical contract or the medical benefits. And what we know there is that the effects of the vaccine just like these social contracts, are very short term. A paper from Israel, first author from Israel, shows that the limited antibodies the vaccines create fall off 40% per month. So in a few months, the antibodies are down to next to nothing. And no surprise that the vaccine breakthroughs now are extraordinary. Over 80% of people in Israel are fully vaccinated. And in fact, over 80% of those with COVID. And in their Delta outbreak currently, their current peak is higher than their pre-vaccination peak. So while they vaccinated intensely and indiscriminately across Israel, it's really backfired from them. The vaccines have done nothing to stop COVID. In fact, more people have COVID than ever. They're fully vaccinated, and then they're failing the boosters. We have now data emerging in the United States through the month of June, just as Delta was really shading in. A paper from Havers and colleagues from the CDC COVID-Net Network, and then from Fillmore from the Veterans Administration, show that 23% of Americans in hospitals have been vaccinated. And now data released from CMS, our Center for Medicare and Medicaid Services, shows through the month of August now, when we're now more fully developed with our Delta outbreak, we have 60% of seniors over age 65 in the hospital with COVID who have been fully vaccinated. And we have well-documented breakouts. The CDC has told us about Barnstable County, Massachusetts. 2/3 of everybody in congregate settings getting COVID are fully vaccinated, and it's Delta. We have healthcare worker studies, one from Keener and colleagues, New England Journal of Medicine. More patients who are fully vaccinated, more healthcare workers who are fully vaccinated are developing COVID than the unvaccinated. And then unfortunately in Finland, from Hedemaki and colleagues, it's been demonstrated that the healthcare workers themselves transmit the virus to the patients when the workers are fully vaccinated. Mm-hmm. So the vaccines have basically failed in a large extent. The hope was that they were going to protect people, that healthcare workers were going to get the vaccines and protect others. That's failed. The paper from Finland, there's another paper from Israel that has shown that. And then largely the vaccines have failed to stop COVID. Importantly, they've failed to stop the important outcomes of hospitalization and death.
Well, yeah, in fact, they've actually causing more hospitalizations and deaths, which is obviously the alarming thing, completely opposite of what they were pushed out there for.
But let me just say, though, it's my clinical experience, and I'm not against vaccines. I just took a vaccine last week for influenza. I take all my vaccines. I'm certainly not against vaccines broadly. It is my clinical experience. So about 70% in my patients in my practice. And unlike a lot of media doctors, I see patients every day. I will be launching a day of patients today after we finish. And I saw really a broad group of patients yesterday. About 70% of patients in my practice, internal medicine and cardiology, have taken the vaccine. They've taken one of the vaccines, and they took it in December, January, February, and March until the safety data came in. And just like all of the Americans, their enthusiasm on the vaccine has dropped. So my observations clinically are, in my practice, that those who have taken the vaccine, I think their cases of breakthrough COVID are easier to treat. I do. I also think they're more aware. They're contacting me much earlier to get treatment, which is wonderful. COVID-19 is a very treatable illness on days 1, 2, 3, and 4 when it's a mild syndrome. And we use a sequenced multi-drug therapy approach, including nutraceuticals. We use oral nasal virucidal therapy now, which is very effective. We use dilute povidone iodine or betadine in a 5% solution, which is wonderful. So we wash the nose and mouth and actually markedly drop the viral loads. And it's been shown in a randomized trial by Chowdhury and colleagues, it can abort the illness in about 75% of cases. So I think everybody listening here should get a bottle of betadine or povidone iodine and learn the dilution, 2 teaspoons in 6 ounces of water, swish it, gargle it, spit it out, then follow it with a mouthwash like Listerine or Scope, and then use a nasal spray of the same solution twice a day. If in the setting of getting exposed to COVID, increase it to 4 times a day. And then in active treatment, do it every 4 hours. It really does work. It markedly cuts down on the intensity and duration of symptoms because the virus is constantly in the nose and mouth, loading the body in the systemic illness. And this is for the vaccinated and for the unvaccinated. And then we follow it with monoclonal antibodies in the United States, and then our sequenced multi-drug approach, which can include hydroxychloroquine, azithromycin. In Russia and elsewhere, it can include favipiravir. The new Merck drug, molnupiravir, will be in that layer. Doxycycline, azithromycin. We use inhaled budesonide, showed in British trials to markedly reduce hospitalization. And then day 5 are respiratory symptoms, weakness in seniors. We use prednisone or dexamethasone or hydrocortisone. We use colchicine through a wonderful large Canadian study all the way throughout, full dose aspirin all the way throughout. And lastly, very high risk patients, we use blood thinners. But we do this way ahead of time. We do this early on, and we're keeping our hospitals relatively empty. We do not see the calls for mechanical ventilators as we did last year. And COVID-19 is much more survivable this year as we've advanced treatment. So this is a really big story for individuals, vaccinated or not. COVID-19 has a real survivorship. And on the other side of this is natural immunity, which is wonderful. The naturally immune state cannot get COVID-19 again, cannot be seriously ill again, supported by 29 studies now. No need for a mask, certainly no need for a vaccine. Natural immunity is probably the most liberating state one can have, and we need to celebrate it.
Yeah, absolutely. And I think the problem we're seeing now with a lot of these governments who are clearly not hitting their targets in terms of take up of these vaccines in a lot of these countries, they're really trying to hammer the whole natural immunity thing and saying it's not that good and vaccines are better, clearly for obvious reasons, which is really, really sad to see. It's we learned all about this stuff in biology as kids. So nothing's changed. Science hasn't changed. Obviously, it's just the pharmaceuticals companies have. But you touched on before then about obviously the healthcare workers are even transmitting it over to patients. We're seeing large percentages of people who are vaccinated who are getting COVID, and it's exactly the same here in the UK. I know so many people over the summer here who have had COVID who are vaccinated, and the first thing they say is, "Oh, it's a good job I'm vaccinated, otherwise I would have ended up in hospital." But in reality is the actual vaccine is causing these variants, isn't it, within them, and the transmissibility that we're seeing amongst groups of people. And it's the same here in schools. So recently there's been loads of reports, and I've been getting sent some of classrooms where kids have been vaccinated, and the ones kids that haven't are suddenly coming out with these horrendous rashes, like large numbers of them. Would you say that is going along the shedding route? I know that there's studies still going on around that.
Well, there's an important concept that we've always had diversity of the virus. There's always been 6 or more strains in the UK and in the United States before vaccination. And once we get to 25% vaccination, as shown in papers by Arcevedo and Neeson, Venkatakrishnan, we basically provide a non-lethal pressure to the virus in the ecological environment that allows the dominant variant to move forward. And that's exactly happened with Delta. So vaccination has created the Delta outbreak. Now, Delta was always there, but United States is 99%. It actually created the dominance of Delta. And each successive variant exists at higher viral loads in both the vaccinated and unvaccinated. And 2 important papers, one from Reimer Isma from the University of Wisconsin Department of Public Health, and another one from Archerian from the University of California at Davis, showed the same thing, that among the vaccinated and unvaccinated, they are carrying high viral loads of Delta, very high. So at low cycle thresholds, 24 is the median, they are loaded with virus. And in the Wisconsin paper, they actually took isolates from the vaccinated and showed that they're very infectious when exposed in the in vitro assays. So you're right. So as the vaccinated go to work or school, they're no less or more of a threat than anyone else. In fact, they're passing the virus to one another. If they go on a privileged vaccine passport trip with one another, they're going to infect each other, just like they did in the Houston wedding outbreak and the Democratic lawmaker Texas flight to Washington and on the British naval vessel. These are all well-known stories where fully vaccinated individuals pass it to each other. In a really tight study done by Chow and colleagues from Ho Chi Minh City, a unit of Oxford Tropical Health, they had healthcare workers locked down. They were in healthcare dormitories. They couldn't go out. They were having an outbreak in the hospital. They're trying to isolate people. These workers were fully vaccinated with the AstraZeneca Oxford vaccine, about a month after vaccination. So they're at the peak of protection, and they were, developing Delta infections and passing it to one another. They had the genomic sequencing. They could actually see who was passing it to one another. So it's clear the vaccines fundamentally don't do anything to reduce spread of the virus. They don't do anything to make the environment safer. What does make things safer is to recognize natural immunity, because the natural immune cannot acquire the infection. They can't spread it. And we should know this by the numbers. You know, our CDC has recorded tens of thousands of vaccine failures, and it's not the universe of cases, but they describe them as either dying or been hospitalized. And sadly, more than 20% of that fraction have died. They're seniors over age 65. And during that time period, the CDC doesn't have a single bona fide case of a failure of natural immunity, not a single verified case. Natural immunity is airtight at this point in time. And I think everybody should take reassurance, no matter what they're told, they can't get COVID-19 again.
Yeah, absolutely that. And I think touching on some of the conversations I've had on the show previously with other experts who explained exactly why when somebody has COVID or has had COVID in the past, the natural immunity is kicked in, and then they've gone and had a vaccine, that 9 times out of 10, that person always ends up in the hurt locker, basically. Every single person ends up very ill.
It's concerning because we now know from a paper by Bruce Patterson presented at the Rome conference that with the natural infection, the S1 segment of the spike protein is recoverable from human monocytes 15 months later after the respiratory infection. So what we've learned is that the body is literally sprayed with spike protein with the respiratory infection internally, and we spend months trying to scavenge and clean it out of our bodies from our immune system. The last thing we need to do is unwisely take a vaccine, have our body again produce a mosaic of cells producing the abnormal spike protein, which is dangerous to the human body, and then have that spike protein redistribute through the brain. We know the vaccine goes to the brain, goes to the heart, the bone marrow, the vital organs. It doesn't stay in the arm. It's very alarming. And then to produce the spike protein within cells, damage and kill those cells in vital organs, and then have it expressed on the cell surface and have the body reawaken an immune system to create an auto attack on its own organs, and then have the spike protein break free and circulate in the bloodstream, damaging blood vessels and causing blood clotting. This has been shown in papers by Ogata and colleagues and others. I mean, to do this in the setting of someone who already has had the virus, is already loaded with spike protein, no wonder we're seeing now in 6 papers, we are seeing much higher rates of safety events, including serious events and hospitalizations in the COVID recovered patients who unwisely are forced into vaccination.
Yeah. I've seen it with actual people I know, which is alarming. And I've, just from them posting on social media, asking questions if anybody had COVID before, still got the vax, and then ended up in the hurt locker, basically. But a lot of the time, these people are being fed the wrong information, because they're not doctors or specialists that really understand physiology, biology. And they're just being told, like, by their workers, or even their own, this is really frustrating, their own GPs, their own doctors are telling these people, like, oh, you still need to go and get it. And this is another horrendous issue I've seen here in the UK. The amount of people that have had really serious adverse reactions to the first one, and then their doctor is still pushing them to get the second one, and they end up in even worse condition, but then there's no liability.
Well, that's an important point, that it's been shown even in the registrational trials, these reactions from shot 1 to shot 2 are amplified by 80-fold. So anybody listening who has already had a severe reaction to the first vaccine, we know the second one, the reaction actually could be so severe, it could be fatal. And it's very worrisome. In a paper by Tracy Hogue and colleagues from the University of California at Davis, she's shown that younger people with the messenger RNA vaccines on the second shot, that's when the explosive myocarditis occurs, the heart inflammation, 86% of the time in the Hogue paper, from very good safety data, both VAERS and other related safety databases of actual cases. 86% of the time, these myocarditis cases in young people are serious enough to become hospitalized, which is very worrisome. And she showed that it hits young men far more than young women, mostly after that second shot, with that amplification of the immune system directing the attack on the heart. We know, I can tell you as a cardiologist, I've seen these cases. They are frightening, very severe symptoms, chest pain, shortness of breath, early signs of heart failure. Sometimes it can be lethal arrhythmias or cardiac death, very high levels of blood troponin indicating heart damage, much higher than a heart attack, EKG changes. And then in about a quarter, there's reductions in heart pumping function already that we need to use heart failure medications to try to prevent the onset of heart failure. It's taken months to resolve these cases. The kids can't have any athletic activity. They're on multiple medications, having multiple visits to the cardiologist. And what Hogue demonstrated, sadly, for a young person, they're more likely to be hospitalized with vaccine-induced myocarditis than they are taking their chances with COVID and getting hospitalized for COVID. And that doesn't count our ability to treat COVID. So if we actually had a young person with severe symptoms, we treat them and we nullify their risk of hospitalization. So the analysis here is that it's absolutely unfavorable to consider the vaccines in younger people.
Yeah, absolutely. And it's, as a father of two teenagers, and I'm glad my kids' school have opted against it, which has been, really welcomed. Thanks to some fine work by some people. And they know the dangers of it. And but also as a sports coach as well, I coach under 16s football team. We're seeing in places around the country where kids are dropping down in sports games, teenagers, and unfortunately some have died. And the local press put it as sudden death, but it's been quite often in this period of time. And a study's just come out in UK that in the same 3-month period, so the July, August, September, between 2020 and 2021, there's a 60% increase in teenage deaths.
That's extraordinary. The vaccines look good coming out of the clinical trials. Pfizer, Moderna, AstraZeneca, and J&J, they look good coming out of the clinical trials. About anywhere from 70 to 90% vaccine efficacy. They looked reasonably clean with 2 months of follow-up. But what we found out is that they had largely recruited people with no medical problems and very short duration of follow-up, just 2 months. And once they were broadly released into the population, all we've learned is bad news. Our regulatory agencies have put official warnings on myocarditis, so on Pfizer and Moderna. So they are telling parents, the US FDA is telling parents, don't vaccinate your kids with these warnings on myocarditis for Pfizer and Moderna. J&J and AstraZeneca have separately warnings for thrombosis, blood clots that develop in really sensitive areas in the brain, the cavernous venous sinus and the central sinus. They're not well treated, and they cause damage to the brain. And then more recently with Johnson & Johnson, Guillain-Barré syndrome. So that's ascending paralysis that sometimes leads the young people to be put on the mechanical ventilator. These are horror stories that we've heard, and they all emerged since the vaccines were released. And I think once it became clear that the vaccines don't work well enough to protect the population or stop the spread, I think that's where people have basically now shown no interest in getting a vaccine. I don't know anybody who wants a vaccine or a booster, and the only ones moving forward for it feel like they're forced out of the social contract. But I can tell you these vaccine injuries are very challenging. Hundreds of thousands, if not worldwide, millions of people have sustained vaccine injuries. And now doctors are trying to figure out how to grapple with them. I mentioned the myocarditis, and I can tell you my approach is to get baseline EKGs, blood tests to see if the degree of heart damage, but also whether or not there's indicators of early heart failure. And if any of the blood tests are elevated, or if the echocardiogram or MRI is abnormal, they actually are going on heart failure medicines called ACE inhibitors and beta blockers. The chest pain and chest discomfort, in my experience, has required colchicine, a drug that we use for pericarditis. Many times this is a myopericarditis syndrome, sometimes corticosteroids. And then we don't know about the risk of blood clotting, but I'm playing it safe, at least with the use of aspirin in these younger individuals. Sadly, some have progressed to cardiac death or potentially the need for heart transplantation, but we just don't know where the end is on these cases of myocarditis. And you're right, we're worried about these cases of sudden death with the kids on the playing field. Again, the data suggests, and our agencies are telling us, don't vaccinate the kids. I mean, you can't underestimate the importance of an official FDA warning for young people. I mean, parents must look at this. Schools must look at these warnings. We cannot have a warning on a medicinal product that's under emergency use authorization and ignore the warning. So this idea of myocarditis, heart inflammation, which can be fatal, warning, and then turn around and ignore a warning. It's like ignoring a red light or a stop sign. We can't ignore it. Now, let me say that there's some other cardiovascular syndromes, and it was a paper published in the journal Hypertension that's important for older adults who have high blood pressure. And what's been reported in this paper is that blood pressure in some individuals can skyrocket after the vaccine, particularly after shot number 2. And this happened. There was a woman who went on Laura Ingraham, Fox News, the Ingraham Angle, a few months ago. She was in her 70s. Her blood pressure skyrocketed after shot number 2, and then she had a hemorrhage into her brain, and she's been paralyzed now on her left side of her body. Tragically, we had a patient in our circles here in Dallas, 42-year-old male, who took the second shot. He was exercising. His blood pressure must have shot up, and it ripped his entire aorta in his body, his major blood vessels. It's been a catastrophe. He had to have a giant thoracotomy, had to have his chest open. He'll never be the same again. And so this paper and Hypertension outlines the concerns there. So anybody listening who has high blood pressure, my suggestion is if you are going to move forward for the vaccine, have very, very close blood pressure monitoring afterwards. I'm not sure as a doctor how to grapple with this, but we may have to adjust blood pressure medications. We also know there's some other cardiac syndromes. There's a much higher numbers of heart attacks and strokes occurring after the vaccine, partly because the vaccines cause blood clotting. The spike protein causes blood clotting. So I'm concerned about people who have heart stents in, heart bypass. These stents and bypasses are very delicate, and they're prone, because they're small, they're prone to blood clotting. People are on some blood thinners to begin with. The last thing we need is to have a blood clotting situation. There are patients who have blood disorders, and they actually are prone to blood clotting. And you should know this because you're from the UK and you're Caucasian. So Caucasians from the UK have higher rates of what's called factor V Leiden. Factor V Leiden is an inherited procoagulant state where people can develop blood clots in their legs, and it can shoot to the lungs and cause fatal pulmonary embolism. Well, it's now known that with blood disorders and clotting disorders at baseline, to take a vaccine that further causes blood clotting is nothing but trouble. And so that's the great concern among our airline industry, where there is prolonged sitting, where the pilots can't get out of the fact of sitting. The stewardesses and flight attendants are standing for prolonged periods of time. And the great concern would be a fatal blood clot. When you're in a position of working. We're worried about bus drivers, school bus drivers, long haul drivers, and others, and this risk of blood clotting. So because we don't know the baseline standing of blood clotting disorders, this is a common question I get is, doctor, I've got factor V Leiden, or I've got the prothrombin variant, or protein C or protein S deficiency, or the MTHFR mutation. Should I get the vaccine? And I said, boy, now my worry is even higher for one of these blood clotting episodes. So this is very important. It's also been shown in a paper in the hematology literature that those who have baseline hematologic abnormalities like chronic lymphocenic lymphoma, those who have myelodysplastic syndromes, that they get a lesser response from the vaccine anyway. So to take the vaccine and take the risks of blood clotting, and they don't get much immunity out of it, that doesn't make sense either.
Yeah, absolutely. And I've been following closely Dr. Jane Ruby's reports because she's been doing a lot in the United States on the amount of pilots and that have been injured, had blood clots. And I believe the reports have just come out that one actually died in air, and the co-pilot had to do an emergency landing, which is obviously at the time when they're trying to mandate these vaccines amongst the air industry. So which is obviously resulting in all these mass walkouts, isn't it, between staff and pilots across the country. And I'm very not surprised why, and I'm sure nobody else is. It's just like in Australia, you've got all the healthcare workers that are being mandated to take the vaccine. I've got lots of good friends there from when I used to live there who are nurses. Yet, why would you go and get something when you're seeing the actual results via injuries coming through the door every single day? And it's not just one or two, it's these wards are becoming full of people as they push and roll out these vaccine mandates across these countries. It just really begs belief. And it's the same here in the UK. they've mandated it for all healthcare workers to work, who work in care homes and stuff like that, that as of November the 11th, which is Remembrance Day of all days, when we remember the millions of men, women, and children who gave ultimate sacrifice for our very freedoms, which we fought for, which we all fully deserve and live by, are then being taken away from all these amazing healthcare workers from around the country, which look after the elderly, and in some cases, many veterans that fought in these wars. It's just really, really beggars belief. But in terms of one area I wanted to touch on as well is, and I'm seeing an alarming rate here in the press and within families and within the actual the wards as well here in the UK, is the constant pushing coercion for pregnant women to get the vaccine. I've seen a lot of papers and reports from the United States with very high percentages. I'm not sure the exact number of women who have miscarried from having the Pfizer vaccination. Is there anything you can elaborate on that for the benefit of the viewers? Because I do have a lot of pregnant viewers that watch the show, because they contact me on social media saying they're like extremely worried, and they're getting a lot of pressure from families saying if you don't get vaccinated, your baby could be born with COVID.
Well, I can tell you, a wonderful paper to give pregnant women some reassurances by Pinellas and colleagues, Annals of Internal Medicine, showing that pregnant women have a lower risk of mortality and complications with COVID than non-pregnant women the same age. So pregnancy is a privileged special state that, in fact, it'd be better to get COVID when you're pregnant as opposed to non-pregnant from a mortality risk perspective. So we know there that pregnancy is not a high risk state. In fact, it's a lower risk state for COVID. And then pregnancy was strictly excluded by the FDA and the manufacturers from the randomized trials because they knew the vaccines were going to be dangerous in pregnant women and that they couldn't benefit. So when they're excluded from clinical trials, we never use them in clinical practice. So when the vaccines have come out, pregnant women did voluntarily take the vaccine. And a paper that appeared in New England Journal of Medicine that many cite, and the first author, I believe, is Shoma Mako. I don't want to mispronounce that, but they'll find it in New England Journal of Medicine, Pregnancy and Vaccines, reported some confusing data in the first trimester where the fetal loss rate could be anywhere from 12% to 83%, depending on which denominator was used. Wow. We know that in the first trimester, the fetal loss rate is about 15% on average. So it was unclear. Many used that paper to say that the data were reassuring, that women who volunteered for the vaccine weren't harmed. But the authors later on came out and said, we actually can't be sure. So they published a erratum to that paper. I led a group of Canadian and other regulatory experts, including Dr. Ray Stricker, who leads a fetal loss program in San Francisco, in Trial Site News, where we published, really our opinion is that the vaccines, like any other medicinal product, are considered pregnancy category X, meaning they should not be used in pregnancy because we don't know that it's safe to do so. And we know the vaccines have a dangerous mechanism of action because the vaccines get distributed to all the organs. Almost certainly they get distributed to the placenta, potentially even to the baby. And we know the spike protein causes blood clotting. And that's the last thing we need to have in a pregnant woman, cause a blood clot in a pregnant woman, which is a procoagulant state. That can be fatal to the mother, but then actually causing blood clots in the placenta and causing various forms of placental hematoma, impairing blood flow to the baby, potentially leading to various forms of cerebral palsy outcomes or anoxic injury to the baby. And then lastly, because the vaccines are brand new, they haven't been tested for birth defects. And I think everyone should be concerned that with genetic vaccines, messenger or adenoviral vaccines, that in fact, if these get distributed to organs that are being formed, especially during the first trimester, we could end up with fetal abnormalities in the children. And it's going to take many years to figure out indeed if the vaccines cause birth defects or not. So the best course of action is to decline the vaccine in a pregnant woman and then just treat COVID if they develop COVID. So importantly, if a pregnant woman develops COVID, we can safely use hydroxychloroquine. We use it safely in women with lupus with pregnancy. We don't use ivermectin, but we can use hydroxychloroquine and certainly nutraceuticals, inhaled budesonide, oral prednisone, oral aspirin. We can even use blood thinners if we need to, and we do with other conditions. So I want the pregnant women to understand that COVID-19 can be treated. They should demand treatment, but the vaccines at this point in time are pregnancy category X, meaning do not use in pregnancy.
Yeah, that's fantastic to hear, and I'm sure the listeners within the UK would gladly pass this information on to the family and the midwives who are actively pushing it on people. And I guess my message to them, and I probably speak on behalf of a lot of people here, is just because your boss says you need to push it onto pregnant women doesn't mean you should ethically push it onto pregnant women, especially in these professions, because you should know better. And I think we're going to come to a point, hopefully in the next 6 to 12 months, where we will see people held to account in various countries, because a lot of legal work is already taking place. And I know people in these positions will not have anywhere to hide. And I can tell you what, there's so many people out there that have done harm, not in just the UK and the United States, Australia, Israel, all these other countries, including in the care homes with use of dangerous drugs, that people will just be hanging everybody out to dry. There won't be anywhere to hide, I don't think, when it comes to it. And I'm sure yourself will gladly look forward to that day, because as a medical professional, it must be quite difficult to have seen so many professionals actively doing harm over the last 18 months.
I think it's driven by fear. You know, the American College of Obstetrics and Gynecology is supporting vaccination of pregnant women. And I don't think it's for the benefit of a pregnant woman, right? So there are no data, no randomized data showing any benefit whatsoever. There are certainly vignettes in the safety databases showing harm. And now there's an authoritative paper, of which I'm an author, that says it's pregnancy category X, and no one's disputed that. So, you know, when there's a paper that is in the literature now that says it's pregnancy category X, that means full stop. And anybody who violates that is really moving into dangerous territory, whether they're recommending it as a healthcare personnel or whether a pregnant woman is accepting the vaccine. I had a call from a mother of a pregnant woman who said that their gynecologist and obstetrician was refusing to deliver the baby unless they took the vaccine. And I told them, I said, go back to that doctor and demand standard obstetrical care. The vaccine is not part of a standard of care. They're not approved by any regulatory agencies. They're pregnancy category X, and they have no demonstrated safety data whatsoever that we can rely upon. So at this point in time, standard obstetrical care is all that our women deserve at this point in time, and they should not be exposed to the hazards of the vaccine. It's just a full stop on that. I can't be any more clear on that. And there's no one who can step forward and dispute those very important statements I've given to pregnant women.
Yeah, absolutely. And not only in pregnant women, we're unfortunately seeing it a lot here in the UK now, where hospitals are actively refusing treatment to people who haven't been vaccinated. It's not in every single hospital, but I'm getting a lot of messages from people where their loved one has been refused. Also, if they refuse to take a PCR test, they're being refused surgery. And some of these people have been on the waiting list for months and months and months, if not over a year.
Well, you know, I commented on national TV for Laura Ingraham, the Ingraham Angle, last week about organ transplant programs that were forcing the organ transplant candidates to take the vaccine. And one example was heart transplant. So patients who are going for heart transplants, they're in heart failure. Their hearts are barely pumping. They're barely in the game. Can you imagine being exposed to a vaccine that causes heart injury, where there's an official warning about heart injury? And so all they need is a tiny amount of heart injury, which is likely to be fatal or take them out of contention of getting a transplant. So a vaccine is the last thing that we need to suggest for patients who are organ candidates. So this is the type of thing where, you know, you just have to ask your question. It's a heart transplant. These are products that have warnings about heart injury. Would we ever use products that cause heart injury in people who are trying to survive to a heart transplant? Absolutely not. Again, if they develop COVID, we would treat it. we would treat COVID and we take our best efforts to get them through the illness. An analysis by Kostoff and colleagues has shown through any age strata, one is more likely to die of the vaccine than take their chances with respiratory COVID. So if someone goes to the hospital and they have COVID, they've actually made they've made an intelligent gamble, because they were more likely to die of the vaccine than die of respiratory COVID. And those hospitals and doctors that are denying unvaccinated individuals treatment, the question is, are they providing care for the vaccinated who come in with their cardiac injury syndromes and their neurologic syndromes and hematologic syndromes?
Yeah, absolutely.
So the idea is, right, so the vaccinated are creating a whole new set of diseases. So the vaccinated are coming in with neurologic injury syndromes. We haven't covered that, but there's official warnings on Guillain-Barré syndrome. In some countries, Bell's palsy, which is not inconsequential. There's been thousands of cases of paralysis on one side of the face or the other. That's a terrible condition. It disfigures the face. Many times it's permanent, and the eye can't close. So now there's chronic eye dryness. The mouth can't close. There's chronic salivary injury to the angle of the mouth. And very importantly, these other neurologic syndromes, and I tell you, in my circle of friends and colleagues, these have happened. Intractable headaches. So if one has a change in their headache pattern after the vaccine, that's been commonly reported. Tinnitus, or ringing in the ears, incessant ringing of the ears as the vaccine injures the auditory nerve. Very important. And then as the vaccine goes up into the brain, into the cerebellum or the cerebrum, we've seen a variety of cerebellar syndromes, a variety of cerebral syndromes. It's been well shown with the adenoviral vaccines, AstraZeneca and Johnson & Johnson, forms of what's called cervical myelitis. In fact, when the Johnson & Johnson program was paused here in the United States, it was for a case of cervical myelitis. And, sadly, in my clinic, I've seen forms of paralysis. I've had to make these reports. Other doctors who are good clinicians and are recognizing what's going on are making these reports of these neurologic injuries themselves. And we just don't know, how far is this going to go? One of my concerns is that people who have any baseline neurologic problem, they've had a prior stroke, or they've had multiple sclerosis, or they've had Parkinson's disease or dementia. My concern is an additional neurologic injury could take them out of being just functional, right? So if someone is barely functioning right now with multiple sclerosis, that vaccine injury could wind them in a wheelchair or potentially bedbound the rest of their life. So those who are taking a pejorative stance against the unvaccinated, we're hopeful that they can at least be compassionate to those who are sustaining these vaccine injuries in the program, because many of them are going to need long-term care and in a sense going to be a tremendous burden on the healthcare system. Yeah,
and exactly that. And I had someone who contacted me, basically had ME only lightly, was advised by a doctor to have the vaccine, had the first vaccine, and then their problems were really magnified from it, explained that their problems were so much worse since they had the vaccine, and their doctor said that they must have got COVID that's made it worse. So make sure you have the second one so you don't get COVID again. Had the second one, and now said person is having to get a motorized scooter to work, which is a quarter of a mile away from our house.
You just can't make this up. So the idea of just keep blaming the victim, this happened from the very beginning, by the way. Before the vaccines in the United States, we were hearing news reports that if someone got COVID, it was because they didn't wear a mask or they didn't wash their hands or they were super spreaders. And so from the very beginning, we've been blaming the victim. And so now these poor souls who have taken the vaccine reluctantly or against their will, now they're being injured or permanently damaged, and now they're being blamed for it again. And so, we see a situation of blaming the victim. I think the most liberating message I can tell you is that, listen, if you don't take the vaccine, there's zero chance of getting a vaccine injury. That's great. So you don't have to worry about that. Mm-hmm. And then if you get COVID, you can be treated at home, many times with things that are available over the counter, and potentially treat yourself, not even rely on the medical system, and then get natural immunity and avoid all harm altogether. Because I can tell you, the goal is, when we get out of this dark place of where we are, maybe in 3 to 5 years, the goal is to be uninjured. And the only way to do that is to avoid the vaccines and then survive COVID. That's the goal.
Yep. And I was explaining this to my son. A few kids have been sent home from the lateral flow tests, testing positive when most of them don't even have any symptoms. And her mother made her do a few tests, and I think she did 4. She had like 2 positive, 2 negative, which just goes to show how rubbish they are. So I said to my son, I said, look at the positive side of it. If she has actually got COVID, she'll have natural immunity, so she doesn't have to worry about the pressures of getting a vaccine.
Let me just say something about the lateral flow. The Brits are in love with the lateral flow test. Remember that these tests are only approved and to be used in acutely sick people. They should not be used to be testing kids with no symptoms at school. So the tests are actually quite useful when someone's acutely ill. If they have a fever and nasal congestion and they're positive on a lateral flow, they've got COVID. But when they're well, and you do lots of lateral flows, the positive tests are just false positive tests. They're completely worthless. None of the regulatory bodies agree with doing this. And the World Health Organization says, don't do it. They say no asymptomatic testing. They put that out June 25th. So all the lateral flows in the schools in England and in travel and in the workplace need to stop. The World Health Organization says stop. The regulatory agencies don't approve that use of the test. I think this is a really important message. Those who are in leadership roles, go ahead and drop their lateral flow. Save it for the acutely ill patients where it's needed.
Yeah. And there's obviously lots of reports about like the things that are on the lateral flow tests. I don't know how much like studies or sort of readings you've done into that, like the ethylene oxide and stuff like that, whether it is, a dangerous amount if you keep doing these tests, because lots of places are demanding, and schools, that kids and adults test like twice a week.
Well, the substances on the swabs may or may not have harm with a one-time use in someone who's acutely sick because it's needed. But we certainly wouldn't want to do tests on people who don't have symptoms. As I mentioned, that's not advised or endorsed by anyone. But there have been reports of overzealous swabbing up in the nose and actually fracturing the cribriform plate, which is the delicate bone that's at the top of the nose where the fibers are for the sense of smell. So I can tell you personally, I don't want any of those swabs up my nose. I'll refuse them. They're not needed. I've recovered from COVID. I don't have any symptoms. So no swabs. People can keep swabs out of their nose because they have no regulatory approval and they're not approved by any regulatory agencies. People can walk past the swab tables. They can just walk past them and view them as something they don't need. And so I know that, for instance, at the Canadian border, I've had personal conversations with people who just walk past the swab tables, and then they're threatened with some type of fine or what have you, and they can't be fined because it's not legal to actually.
It's unlawful. Yeah, exactly. And it is. This is what I keep saying to a lot of people in the UK, and lots more people are watching the show now who do get it. But when it's been in the system for such a long time now, and it's like the be all and end all. And my son said it to me yesterday. He said he's just getting sick and tired of like the word just being in and everything that they do in everyday life. And when kids are starting to get fed up with it, they just want to go to school and have an education. And I'm very passionate about the education and development of teenagers, obviously with my football team and with my own kids and friends. So it's a big part of my life, and I'm very passionate about them just being able to get an education and all this disruption. So if they're having to do these pointless tests all the time, and I use an example as my football team, we play in a league, obviously on a Sunday, the amount of times kids are like testing positive on these lateral flow tests. So then they're having to isolate for 10 days. And then so are other players in the team. So the game get cancelled and like nobody's sick. It's just, but nobody's willing to stand up and take, ownership and say, look, let's just nip this in the butt now and just say, right, is anybody actually sick? No, like, okay.
Yeah, just overturn the policy. What people are doing, they'll just use the povidone iodine spray in the nose and you probably never test positive. I think people will do that and just say, forget it. And you get to a certain point. Many of these things are dropped because they're found to be so useless. They're dropped without any explanation. So we've seen testing going on, then suddenly people don't do testing. And we've seen all this vigilance, and then suddenly there's not vigilance. I walk into a medical center every day. I can tell you, I've never been tested. And I'm dealing with sick patients. I'm not playing soccer or football or rugby. I'm not having fun. I'm around sick patients, and I've never been tested. because we don't do testing. We do a quick temperature check. I walk in front of a temperature scan, make sure I don't have a fever. The only thing that matters is symptoms. If I don't have any symptoms, I can't pass COVID to anyone else. The only thing I want the parents to know is if the children are sick, don't let them go to school. Don't let them go to sports. And that's the method by which we stop the spread. If someone gets sick at school, pull them out of school, put a mask on, and go home. That's the use of the mask. So we need intelligent sick kid policies, intelligent sick employee policies. We need to stop all asymptomatic testing. And people start using povidone iodine, they're not going to turn any test positive anyway, because it kills other viruses and cleanses the nose and mouth. And I think we'll move on from this probably just through either mass resistance or just a loss of interest. And one day the testing will just be dropped without any explanation. So.
Yeah, I can see that happening as well. And I know the PCR test has been said it's going to be pulled out of circulation in the 31st of December. Because they said it doesn't differentiate between COVID, flu, and other coronaviruses. What I find alarming, though, is the fact that they've said that, but then they're not pulling that out straight away. They're leaving it to the 31st of December, and yet it still dictates everything that everybody does. I
just want to clarify that point. In the United States, the CDC original methodology for the PCR cannot distinguish between flu and influenza, and the CDC has notified us of that. That was the basis for the laboratory-derived assays, the original ones that each hospital system lab had. We have major manufacturers now, Roche, Abbott, Ortho Clinical Diagnostics, LabCorp, Quest, you have them as well. My understanding is those methodologies are sufficiently different that those will go on, but the original Department of Community Health and the government testing centers, they've actually had the wrong method all along. Those are going to be mothballed. And what we need to know is that moving into the flu season, if someone is, say one of our senior citizens is sick, demand both a flu test and a COVID test. Don't let them be diagnosed with COVID only, because so many influenza patients were misdiagnosed as COVID, and then they were put in isolation, given remdesivir, Decadron, all these therapies that were actually inappropriate. So we had inappropriately diagnosed influenza last winter. And so we want to make sure that doesn't happen. So I want everyone listening to this to demand both a flu test and a COVID test to have the system, because some of these PCRs may still be in circulation. If you get a PCR, make sure that the cycle threshold is at below 28. That's current CDC recommendations. I'm still seeing PCRs at 45. At 45, it's almost certainly going to generate false positives. So we want to demand low cycle threshold PCRs. Delta, which is the most prominent strain right now, that has a median cycle threshold of 24. So it's easily identified on the low cycle threshold tests.
That's absolutely fantastic information, and very, very valuable. I mean, this PCR test was something we've been talking about for ages. And what really frustrated me when they came out with this, that they were going to pull the test because it doesn't differentiate between flu and COVID, is the fact that just here in the UK alone, 300,000 businesses were closed for good because of lockdowns that were brought in because of the number of cases, but these number of cases weren't COVID cases. And I was saying to people, like, why aren't people like screaming, shouting the roofs down? Like, their whole lives have been turned upside down because of this one test.
Well, the closures came from studies early. There were modeling studies that were assuming that, anywhere from 40 to 50% of spread was asymptomatic, meaning someone could just walk into a business, have no symptoms, and spread COVID. We know that can't happen. So good papers from Cow and Madewell have shown that asymptomatic spread fundamentally doesn't happen. So as long as someone's not sick, there's no way there can be any transmission in the businesses. So there really haven't been any business outbreaks. We haven't heard outbreaks from shopping malls or outbreaks from Apple stores or anywhere else, because there's no asymptomatic spread. If it could be asymptomatically spread, we would have had massive outbreaks. And so now in the United States, our professional football and college football, they're sitting shoulder to shoulder, 80 to 100,000 people in stadiums, and there's no outbreaks because it's not spread asymptomatically.
Yeah. And I think a lot of the reason is because obviously you can drink beer and rubbish food, can't you, at these football stadiums as well. So they tend to like that. But I've seen a lot of conferences being like shut down, health conferences, which I find finds quite remarkable and quite tedious, to be honest. Just one last thing I wanted to touch on, Dr. McCullough, is obviously we talked about the millions of people worldwide who have, for whatever reason, they thought it was the right thing to do at the time. They wanted to go on holiday, they wanted to protect themselves or their families, just like most of the people I know, my own family, who've gone out and had the vaccination. However, they're in a position right now where they can see what's going on. They can see all the stuff like the injuries. They've potentially been very ill themselves from it. And they're concerned about, obviously, the winter coming up in the Northern Hemisphere and what that might bring to them. What can they do as an individual to, in essence, like reverse some of the effects that vaccine has had on their body or is having on their body?
Well, obviously, one point is once the vaccine injection is in, it's in. But a large number of people have taken the vaccine. In the UK and the United States together, it totals hundreds of millions of people have taken the vaccine, and nothing has happened. They haven't had any side effects whatsoever. And so, we have to make the point that a huge majority of people have not had any serious consequences from the vaccine. That's wonderful. That's good news. Mm-hmm. But it's not okay that certainly in the United States, we have over 15,000 who are reported dead and hundreds of thousands who have been hospitalized, over 20,000 injured. That's not okay. So just because a large fraction did fine, it's not okay. It's not a price to pay, if you will, to have others die or injured due to the vaccine. Now, when one gets the vaccine, the first thing to understand is that the degree of reaction on the first shot predicts how severe the second shot's going to be. It's going to be 80-fold worse on the second shot. That was shown in the registrational trials. So we need fever control for sure, because sometimes the fever is so high with the shot that the fever, particularly in children, and this was shown in the registrational trial by Frank and colleagues, New England Journal of Medicine, May 27th, was shown that sometimes the fever can be 40 degrees. Well, I can tell you a 40-degree fever in a child can provoke a seizure. So the mothers need to understand that the children need to have temperature checks after the vaccine and make sure they get the fever under control so we don't prompt a seizure in a small child. This is very important. In senior citizens, the fever can be so serious that, in fact, it can lead to dehydration. And most of the deaths that are occurring in our seniors in these acute febrile situations where blood pressure drops with fever, nausea, vomiting, difficulty breathing, and then they die the next day. That's the most common vignette. So we need temperature checks after the vaccine. Adults with high blood pressure needs blood pressure checks after the vaccine for both high and then suddenly low blood pressure. Those with blood clotting disorders need some type of approach. They should talk to their doctors ahead of time and understand if they should go on aspirin or potentially go on blood thinners because the vaccines are so dangerous in terms of blood clotting. In individuals who develop headache, they develop a double vision, they develop a hearing loss, they need prompt evaluation, including CT scanning or MRI of the brain, because it could represent a blood clot. And so if a blood clot is there in the brain, we cannot fool around with that. The warning for J&J and for the Oxford AstraZeneca on central venous thrombosis is actually the thrombosis that happens in the brain causes tremendous bruising around the eyes. So if around the eyes, a purplish bruise starts to develop, immediately go for a CAT scan, immediately. It's very important. So people take the vaccine, they should take it seriously and be aware that the vaccine can cause great harm. So the younger kids, if they develop fever and they have general muscle aches and general aches and pains, as 40% do in the paper by Frank and colleagues, the mothers and the fathers should be asking the child about chest pain. And if there's any chest pain, promptly go to the accident emergency department and get an EKG, cardiac troponins, and get assessed for myocarditis. Because if heart damage is occurring in a child and it's unrecognized, it can lead to permanent damage. And if myocarditis is diagnosed in the paper by Hogan colleagues, 86% of the kids need hospitalization. So make sure that the child is asked about chest pain. It's very, very important. A lot of times kids want to play and they want to underreport it, but ask the kids about chest pain. Men more than girls develop myocarditis. And then lastly, for these hematologic disorders, There's a disorder called vaccine-induced thrombocytopenic purpura, VITT. It has a new name. After about 2 weeks after the vaccine, if a skin rash develops, if the urine turns dark or blood in the urine, if there's general bleeding from the gums, immediately seek evaluation and get blood testing and urine testing. That's probably vaccine-induced thrombocytopenic purpura. Many patients need hospitalization. They may need corticosteroids or plasma exchange. So, I mean, the best advice I can give people is to be vigilant afterwards. There's no antidote for when this vaccine comes in your body, but it's up to you to keep a watch for these problems that develop. Our regulatory agencies have official warnings. They're telling you that this can happen with the official warnings from the US FDA, the MHRA, and the EMA. So they are telling you this can happen, warning. And so these warnings, pay strict attention to the warnings, because that means it's going to happen, and it's going to, the person who takes the vaccine could be the next person that it happens to.
Yeah, absolutely. And I mean, unfortunately, I now know 9 males who are under 40 that have had heart attacks, two in the military, which I just find it shocking that so many of people in the military have taken the vaccine. I know it's been under a lot of peer pressure. I know what it's like, obviously having that peer pressure from being in the military 15 years. And I know that people are just following orders. But we're also seeing these injuries as well, which is terrible. And I get messages on a daily basis, like from people around the world, speaking about their current injuries, or their mum and dad or brother or sister have suddenly like collapsed, and this has happened. Some people send me pictures and videos. So, it's not the nicest things to receive, but it just, I guess, fuels me to empower people more, to learn more information, and watch podcasts like this with people, experts like yourself, and Richard Fleming and Jane Ruby and Brian Ardison, people like that, who have go out of their way to find all this fantastic information. In terms of like ointments or things like that, I mean, a lot of people say, drink pine needle tea and all this kind of stuff if you want to reduce the graphene oxide and all this kind of stuff that's in these shots. Is there other things, including pine needle tea and all this kind of stuff, that you think that may help people?
Again, the best way to avoid the vaccine complications is not to take the vaccine.
Yeah.
Many people say, can I have my cake and eat it too? Can I take the vaccine and get all the social benefits of the vaccine? And can I avoid the injuries? And that's the hardest thing to tell. Most of the time in life, you can't have your cake and eat it too, right? I mean, it's just one of these basic facts. Can you actually get the best of both worlds? Can you take the vaccine and get out of it with any injuries? Obviously, a huge number of people have taken the vaccine. Nothing has happened. Wonderful. We don't have an anecdote approach, and I don't advise one for anyone because of that. Obviously, there's no randomized trials. We don't have any supportive data. All I can tell you is these vaccine injury syndromes look very similar to the COVID long haul syndromes, very similar. And because it's related to the spike protein. So the listeners may want to go to a website, flcc.net or frontlinecriticalcareconsortium.net, and they may want to look at what's called the Irecover Protocol. And it's a protocol, again, not based on randomized trials, it's just based on a clinical judgment about what can be done in long haulers, and may want to look there and see if any of that applies to post-vaccine situations. But like I said, absolutely the best way to avoid a vaccine injury is not to take the vaccine. The best way to deal with the social contract is to absolutely nail down what the social contract is. Most people taking the vaccine, for instance, they have no idea what they're going to get. Are they going to get 3 months of military service, a month, 6 months? No one's telling them.
And absolutely.
So we're coming down to a big showdown. It was announced yesterday in Texas. And for the UK listeners, Texas was one of the few states that it was his own country. Back in 1845, Texas was the Republic of Texas. We're his own country. And Texas, yesterday, Governor Abbott announced a broad-based ban on vaccine mandates, even among private businesses. We've already had a ban on Texas government entities mandating the vaccine, now private entities, and it has very broad support. No one wants the vaccines.
Yeah.
There's no one among the population. People are protesting. No one wants the vaccines. Nobody even knows who's mandating the vaccines. So, if you look at Southwest Airlines or American Airlines, who actually is mandating the vaccine? Who wants the vaccine? No one wants them. And so you can imagine the public support at this point in time. It will be a national or international holiday the day the vaccine mandates are dropped.
Yeah, no, absolutely.
Holiday, right? People will celebrate in the streets of London when the vaccine mandates are dropped. They are so unwanted. They're viewed as a menace. People know the vaccines don't work well enough, and they know they're not safe enough to ever be mandated.
Yeah, and all the time people know that and see it. The draconian and sort of dystopian measures just get wilder and wilder, and the restrictions on travel and work, and I mean the stuff we're seeing in Australia at the minute is just unbelievable. It's just like a dictatorship in Victoria, with the Premier Dan Andrews there, and I truly hope that what's happened in New South Wales with the Premier there having to resign, follow suit very quickly in Victoria, because that man's going to have to go to hiding. Like, there's no way on earth.
Well, in the United States, we've already had two of the highest FDA officials for vaccine regulatory work. They resigned 7 days after the Pfizer meeting on August 23rd. And the Pfizer meeting, Pfizer was not approved. And so because a false talking point was generated from that meeting, and there was great dissent on boosters, which the initial vote on boosters was basically 16-2 against boosters. So Pfizer wasn't approved, boosters not endorsed. The two key regulatory persons, including the person who signed the letter for the biologic licensing agreement to Comirnaty BioNTech, she resigned. The overall head of our National Institutes of Health has resigned. And so I think we're going to start to see cracks like this again, because no one wants this. So when people say, well, who actually is in charge of the vaccine mandate? Nobody seems to know, because they're so enormously unpopular. And so at this point in time, I think the key thing is for the public to continue its messaging to its leaders, to tell them, listen, we don't want the vaccine. We know it doesn't work well enough. We know it's not safe, and we don't want it. And we're not going to take it. And I think if that message continues to, this is about the power of the people. This is not about the courts. We don't see any fairness in the courts. We don't see any fairness anywhere. It's not fair that they're making your kids take lateral flow tests. The only thing that's going to really get people's attention is when they go walk past the table and say, I'm not taking it.
Yeah, absolutely. And that's the key thing, is just saying no. And I think it's difficult to get large portions of the population to say no more and actually stand up, because that's one of the biggest threats we've had here in the UK, is just the mass population just aren't saying no. They're not, they're just conforming. And I think where we've had this lull in everyone having kind of like freedoms back, so to speak, in terms of bars, cafes being open, people to go into work, the only thing really, the occasional places talking about, oh, you might need to do an LOT to come in, and you don't have to wear a mask anywhere. It's all personal if you want to or not. But obviously there's a lot of concerns, and it's one of my concerns that we've been given these freedoms back because so everybody has a taste of them. And then suddenly when we start seeing all these vax injuries and potential vax deaths as a result of Delta, over the winter months, they're going to be labelled as COVID deaths and like COVID cases. And then they're going to start bringing these masks and everything start ramping back up again. Now,
well, every vaccine injured person really needs to make a profile, and on social media, make it really clear what happened. They need to message to their family members, their people at work, put a picture up in their cubicle. It's up to people to let others know what's happening. And a vaccine injured person can be very, very helpful to alert others on this. A vaccine death needs to be highly publicized so others can avoid death. So, everybody can play their part right now. This Texas, with this recent proposed ban yesterday on vaccine mandates, everybody needs to message our Texas lawmakers on the House and the Senate side in the state to basically approve this legislation. I think people outside Texas need to message them too, because if Texas can lead the way on this and we can be completely free of vaccine mandates, Oh my Lord, that is going to be a giant signal. You know what we say to our US citizens? We say, take a look at Australia. It's just like the US. Melbourne is just as nice as San Diego. Many of us have been to Australia. Australia has hardly any COVID. So on most days, they have more vaccine deaths than COVID deaths.
Yeah, absolutely.
And they're shooting rubber bullets at each other for no reason. So you can see how what's happened. There's been a distorted thinking. There's a mass psychosis. The vaccine has been propagandized. It's been socially weaponized. It's basically being used as some type of tool to divide us and destroy us. And the sooner that the vaccine mandates can go, and the sooner the vaccines can go away themselves, that's our pathway back to normalcy at this point in time. We can treat COVID. I'm not worried about COVID, but people are enormously worried about the vaccines. They're a menace and they need to go.
Yeah, no, absolutely. Dr. McCullough, it's been an absolute pleasure to have you on my show. I've been dying to have the legend himself on the AJ Roberts show for quite some time. I know you were on my good friend Dan Gregory's show a few months back, and I watched intensely. Just so much value, and that's what I love about doing the show, is not just being able to give the public the all the information through people like yourself, but as we're doing this right now, I'm in the hot seat and I'm getting it firsthand from these phenomenal experts on different sides of the planet. And this is why I love doing what I do as well. It's just like free education, and almost someone who knows the body very well. It's amazing for me to sit here for over an hour and just be the student at the same time, whilst actually treating the public to such phenomenal information. So thanks for taking the time out of your busy schedule to share with my audience all that phenomenal information. It truly is magnificent. And if people haven't done so already, guys and girls, please follow Peter McCullough and all of his stuff, all his interviews he's done all over YouTube, Rumble, BitChute.
Right. And let me mention that you can follow me on America Out Loud Talk Radio, America Out Loud Talk Radio, The McCullough Report. And I interview experts from all over the world. This is a worldwide problem. We cover treatment, vaccine safety, efficacy, other key social and political issues. America Out Loud, The McCullough Report, and everything cited. Everything I said today is cited. So you can look up every one of these papers yourself. It can't be categorized as information or misinformation. It's just data. I gave you the data, and the listeners can make their decisions regarding their health. So thanks for having me.
Amazing. Guys and girls, I hope you enjoyed another fantastic installment of the AJ Roberts Show on the London Times. I'm sure you'll agree that the information that Peter shared with us today is second to none, and please do with it as you wish. But as always, my only fee, because I don't have any sponsors on the show, I don't earn any money from this, is my only one fee is that you share this with at least one person that it can help. Okay, just one person, and that ripple effect. And I know the difference it's making because of how much the show's blown up because of that. Okay, so please make sure you share this episode far and wide. And if you haven't done so already, please check out the links in my bio on Instagram. Subscribe to the YouTube channel, the Rumble channel, BitChute channels, and obviously my Telegram if you haven't done so already. But till the next episode, look after yourself, stay strong, and I'll see you next time.